This episode is brought to you by United Airlines. When you want to make the most of your vacation, book with United. They're an airline that cares about your travels as much as you do. United is transforming the flying experience with Bluetooth connectivity, screens, power at every seat, and bigger overhead bins to help fit everyone's bag. And with their app, you can skip the bag check line, get live updates, and more. Change the way you fly. Book your next trip today at united.com.
Welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm your host and public health scientist, Dr. Jess Steyer, and today we are going to talk about our food supply and how we know it's safe. The clock is ticking, so let's get to it. All right, so let's answer the question that I get all the time. I keep hearing about chemicals in food. How does something even get approved for use in our food supply? So this is a great question, and I want to start off by saying that everything is a chemical. We are literally sacks of chemicals as human beings. But before any new ingredient can be added to food, companies must prove to the Food and Drug Administration, the FDA, that it's safe through extensive scientific testing. We're talking years of research, animal studies, and safety evaluations in humans. The data is reviewed by independent scientists, and only when there's clear evidence of safety does it get approved. Think of it like a really intense job interview, but instead of lasting a few hours, it can take years and requires mountains of scientific proof. All right, so what exactly are they testing for? They're looking at everything: how the substance is processed in the body, whether it could cause any harmful effects, and what happens with long-term exposure, and what amounts are safe. Scientists determine something called an acceptable daily intake, abbreviated as an ADI. But here's the important part. They build in massive safety margins. We're talking levels 100 times lower than what caused any effects in the most sensitive animal studies. It's like having not just one safety net, but 100 of them. All right, so I saw on social media that some ingredients allowed in the US are banned in other countries. Why is that? This is one of those viral claims that really needs context. So different countries take different approaches to regulation, but that does not mean that one is safer than the other. So think of it like driving. So some countries drive on the left, others on the right, and different approaches, but both of them will get you safely to your destination, right? So the US takes what's called a risk-based approach. So looking at actual exposure levels and real-world data. Other places might take a hazard-based or precautionary approach. Neither is wrong, they're just different ways of ensuring our safety. How do we know these ingredients stay safe over time? So we don't just approve things and forget about them. There's constant monitoring through several systems. If someone has a reaction to a food, it gets reported. Scientists continuously review new research. And if safety concerns emerge, action is taken quickly. Remember that rotavirus vaccine that was withdrawn in 1999? That's our safety system at work. When we find a problem, we address it. And this goes for vaccines, medications, as well as our food supply. All right, so what's your bottom line on food safety for parents? Here's what I tell parents. Our food supply is safer today than at any point in history. The dose makes the poison. Even water can be toxic if you drink too much. Focus on serving a variety of foods. Don't let fear drive your decisions. And remember that a balanced diet is more important than obsessing over any single ingredient. All right, well, I hope you learned something today, and we have lots more to share. You can get your daily bite of health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
If you're listening to this podcast, then we know you love learning. So let me tell you about Airwave History Plus, now available on Apple Podcasts. Airwave History Plus is your ticket to ad-free listening, bonus content, and early episodes from dozens of the most popular history podcasts, including History That Doesn't Suck, The Explorers Podcast, The History of World War II, Queen's Podcast, The History of Egypt, The Age of Napoleon, and more. For your free trial, search Airwave History Plus on Apple Podcasts and hit subscribe. That's Airwave History Plus, available now on Apple Podcasts. Airwave History Plus, the essential audio destination for history lovers.